Hi everyone. So I wanted to make a quick video on how my neck's doing and a quick update. So I am preparing for a fifth PICL and I wasn't actually anticipating to get a fifth because I was doing so well, but I ran into some complications earlier this year that I'm going to tell you about. So starting in about January, I started having a lot more symptoms. It was the same exact symptom pattern that I was having before: vertigo, blurred vision, brain fog, and I knew right away that something was going on, especially because my vision hasn't been a problem for me in, probably 2 years. And so I currently live in Mexico, and if you've never been to Mexico, then you wouldn't know that there are a lot of speed bumps here, and the speed bumps in Mexico are a lot more aggressive than anywhere else in the world, I think. And they've been really jostling my neck a lot when I'm driving. And so I had assumed that perhaps just driving in Mexico, living in Mexico, and dealing with the speed bumps and just the rocky roads has somehow been damaging my neck, and it seemed reasonable to me. But um, that's not actually what I found out was going on. It took me a few months to put this all together, and I just realized this about a month ago. But in January, I started orthodontic treatment. I started orthodontic treatment not because of any particular issue, just for aesthetics. It's not like I have any other, and my teeth aren't even that bad. But I started orthodontic treatment for just for aesthetic purposes, and I didn't connect things because it was sort of gradual. But right when I started orthodontic care with invisible aligners, that's when my symptoms began to come back, and it took me literally 5 months for me to realize that that's what was happening. So I stopped wearing the aligners about a month ago, and within 3 days, all of my symptoms that I was having completely went away: the blurred vision, vertigo, dizziness. However, my neck now is a lot less stable than it was before, and I'm having a lot more muscle tightening in my SEM, I think, due to the instability. So I'm really grateful that I don't have symptoms, that I don't have my neurological symptoms, but it's very clear to me that whatever I was doing with my teeth was changing the way my jaw was sitting, it was changing the way that my skull was sitting on the spine. And so I just wanted to share this as a warning that if you have upper cervical instability, CCI, don't start messing with your teeth unless you're ready and willing to have your situation be made worse. Now, I was thinking about getting a fifth PICL because I'm probably a little greedy, and I won't be totally happy until I'm out there doing like extreme sports without any issues or complications. So I was skiing, but skiing was hard on my neck. It really was. But I was skiing. I want to get to the point where I can ski without it being hard on my neck. I want to be able to bike outdoors, not just on my indoor Peloton bike. I want to be able to ride a motorcycle and wear a helmet and not have to worry about, the vibrations hurting my neck. And maybe that's not possible. We honestly don't know what is or isn't possible with this procedure. It's so new. But I'm going to keep trying while I have the ability and financial means to. Why not invest in my health and my neck? So my goals for this next procedure are really to um, get back to where I was before, just in terms of the stability, and help with the tightening of the muscles in my neck. Thank God that I'm not symptomatic from a neurological standpoint, but I want to get back to that. And in fact, I want to do better and be able to maybe this winter season ski harder than I have before. Um, I guess on a personal note, so I'm moving back to the United States from Mexico, so I will have spent 1 year down here, and I'm moving back to Colorado, and I'm going to be near the Regenex headquarters, and I'm looking at getting a house and hopefully having a spare bedroom for other PICL patients who are traveling in and they don't have the financial means to, or at least it is very difficult to get a hotel and deal with the added expense of traveling. Um, when I first had my first PICL, thank God it was comped as part of the research study because I was out of a job and I was dirt poor. And if I had to travel in from out of country or out of state and stay at a hotel, there's just no way that I could have afforded to do that. So I want to, now that I have the means to, I want to create a space that travelers can use if they're getting this procedure, totally unaffiliated with Regenx and no cost associated, but just a way to give back to the community. So I hope to have more details on that before the end of the year. So that's pretty much it. I mean, my life has been pretty good. I'm working down here and uh, day to day, my neck has not been problematic except for the few months that I was wearing braces and, well, I guess clear aligners, not actually braces. I hope this helps anyone who has CCI who's thinking about doing orthodontic treatment. I wouldn't have thought that dental treatment could actually be related to CCI, but I'm not surprised anymore by anything with this disorder. So, all right, hope you have a great weekend. Bye.